we go. We're live. Taha, can you hear me?
Yes.
Perfect. Welcome. So this is one of our early podcast chats in Health First Group. Today we have Taha, who is one of our physios currently on the Gold Coast. He's been to one of our regional clinics as well in Mount Isa. So he's kind of split his time between those two clinics so far. So welcome, Taha. How's your day going?
Pretty good. Having a good day. I've been waiting for you to start this podcast for a little while. So congrats on starting it.
Good. And one of the first people on. You should feel special.
Yes. Looking forward to all the episodes coming up.
Good. So tell us a bit about yourself, Taha. So you're Canadian, aren't you? So do you want to give us a bit about your background and a bit about your sort of physio career so far?
Cool. Yeah, so I was born in Iran, grew up in the Middle East until I was about 10 years old. And then my family immigrated to Canada. So I pretty much, I guess, grew up in Canada and did my undergrad there, became a personal trainer, worked as a trainer for about 6 years. Actually enjoyed it quite a lot. But anytime I had clients that were injured or had different conditions, I would feel a little bit lost. I didn't know how to help them. So that kind of made me become kind of curious to see how I can help them out. And that sort of started my physiotherapy journey. I applied abroad. I know you're from the UK, so I applied to some UK universities. I applied to Australia, Canada, different places, and ended up coming out here to study at University of Queensland. Did the master's degree there. Yep. Really good uni, great professors. And yeah, after I was done, I found a video of Shane talking about the new grad program here. And that's how I ended up joining Health First Group.
Very nice. So obviously you applied to quite a few places. So why Australia? How did you end up here and not in the UK, for example?
Well, I just looked at the rankings and I talked to a few friends that have been to UQ. Yep. And UQ seemed to be the best university for physiotherapy. So I guess different universities have different strengths. Yep. And I sort of realized in terms of the top researchers and professors and all the different resources, Australia was up there and pretty similar to Canada. So when you go back to Canada, you have to do certain exams to be able to work as a physio. And Australian students tend to have the highest passing rates out of any other country. So right. That was sort of the main reason I ended up coming here. And also the beaches. I want to learn how to surf. So
can you surf?
No, I suck. And seeing shark videos here and there definitely discourages me.
Yeah, nice. It's funny. The setup in the UK is very similar to Australia in regards to how physio is taught, I guess, which is very similar to Canada as well. There's a few countries. South Africa is another one. New Zealand, which is another one, which teaches a very similar curriculum, I guess. So there's a lot of crossover there. But yeah, is it hard? So, I mean, for example, me coming from the UK, it's surprisingly difficult to get registered here. I feel that, I mean, I was 5 years experience when I came over, which was about 10 years ago, but I felt like it should be quite an easy process. Yeah. But it's not. So for you to go home to Canada, what would you'd have to do some exams, but is it pretty hard?
Yeah, it's the same process. You have to go through a credentialing process, and then so they look at your university and all your paperwork, and then you can apply for the written exam, and you have to pass the written exam, and then you have to apply for the clinical exam, and then you have to pass that one, and you have 3 tries. So if you fail 3 times, you can never do it again. So it's a bit stressful, but high passing rates from Australia, and they do different courses that prepare you for those exams. So it's sort of a long process. If you graduate and you want to go back home right away, you might not be able to work that soon. Whereas I guess in Australia, you can start working right away. But yeah.
It's pretty similar to the US in terms of, because the US seems a bit more prescriptive in regards to the way that the physical therapists work there, as opposed to, obviously we do a lot of diagnostic work, but is Canada, where does Canada sit in regards to that?
No, it's very similar to Australia, actually.
Yep.
I'm not too familiar with US programs. I know that they have DPTs instead of masters. So their programs are 3 years long. And that's the interesting with Australia. There are undergrad programs, master's programs, and DPT programs. And they're sort of all very similar. And you can pretty much work as a physio if you do any of them. But in Canada, you only have the masters. And in the States, I think you only have the DPT program, unless you go on and do PhD.
Yeah, okay. Yeah, right. Do you foresee yourself going back to Canada at some point, or staying in Australia long term? Like, what are your sort of plans? I'm not going to tie you down to
Australia
negotiations right now, but
no, I'm loving Australia right now. I have like a 3-year work visa, so I'm definitely planning on staying here for now. Maybe if I'm thinking 10 years down the road, I would like to be able to work in Canada as well. Whenever I've thought about this, I think the most ideal way would be in like 10 years to be able to work in Canada and Australia, so that I have both connections. That would be quite ideal.
That was my dream. I was going to do like 9 months in Australia, 3 months in the UK, and then I had a kid. Now I've got another kid, and so hold on to that dream as long as you can. And you may get there.
Yeah, true.
Cool. So I guess studies of physio at uni here. So you studied at UQ on the Gold Coast. And what have you found? Oh, Brisbane.
Brisbane, yeah.
Yep, cool. And what have you found in terms of university versus private practice? So do they prepare you well for private practice, or not? Like, how have you found the transition?
It was quite interesting. I thought most of what we learn as physios before I did it would be MSK related. But then you realize there are all these different branches of physio. So we had courses on, pediatrics, geriatrics, neuro, rest, research, all these different courses. So I think at UQ, they prepared us really well in terms of the basics, but you don't really get to go in depth in any one area. When I actually came into private practice, there were a couple things I think I could have been prepared for a little bit better. One was my manual skills, and I think maybe a big reason I felt that way, COVID started when we were studying, and a bunch of our courses ended up going online. And it's not the same, when you practice on all your classmates and the teachers there, it's a bit, I guess you learn a bit more than practicing just on your friends at home. So that was one area. And also, I wish we learned a little bit more about complex chronic pain cases, because you sort of learn, I guess, different areas of the body, how to assess and treat. And sometimes, you might get clients that have multiple areas that are painful and they're stressed out, and they might have diabetes, they might have different conditions going on. And as a new grad, that would be one of the cases you would, I guess, throw new grads off.
It's hard, isn't it? Because I guess you sort of maybe at uni you feel that people should fit into categories. And, this person's got a disc bulge, therefore I do this, and this person's got a facet joint, therefore I do this. Whereas
exactly.
I guess you then very quickly realise that they've got a bit of this and a bit of that, and maybe there's something else going on, and there's lots of different things. So interesting as well about the manual therapy. So I've been doing some interviews recently for new grads for the new grad program next year, and they've sort of said the same things in that they haven't really been able to practice the manual therapy based on COVID. I feel they feel they probably would have been underprepared anyway from a manual therapy perspective, but COVID probably worsened that. They haven't been able to complete as many placements. They haven't been able to do as much sort of practical work. So that is an area that they feel a little bit underskilled in. What about the clinical reasoning process? I often find that you guys are pretty good at assessing, and they have all the repertoire of assessment tests, but then sort of formulating a diagnosis from that and then formulating a treatment plan, that's probably a bit challenging. How did you find that?
I think it's pretty common for new grads to overcomplicate things. So, if you gave them an hour to write down all the right assessments and treatments for a low back case, they would give you the right ones. But when it's happening in person, and they're testing something, and they're trying to go with the flow and put the puzzle pieces together, it's easier to get thrown off. And I definitely found that in the beginning. So I would do I think I would have done the right assessments, but by the end of it, I would be overthinking about, what I need to do for treatment. And with experience, I kind of learned to keep it simpler. Like instead of doing 10 assessments, I would do like the top 3 or 4 that I found were relevant. And same thing with treatment. I would just educate and so on.
I think that's going to lead you into like time management as well. That a lot of new grads struggle with is they feel like, I've got 10 tests that I want to do on this client, but I also want to start I want to do a bit of education. I want to start a bit of treatment. And if you've got like a 40-minute assessment, then, you can't do everything in the first session. And I think like that's okay. And I also think because then once you've done your 10 tests, you kind of want to throw like 6, 7, 8 treatments at them as well. And again, like you just can't do that. And that's fine. Like start off with, your 2 or 3 treatments. And then in your second session, reassess, do a few more tests, change the treatment up a little bit. But yeah, I think you're right. I think a lot of new grads try and sort of overcomplicate it and do a bit too much for every client. But that's a pretty good learning.
I think if we had more simulation practice in uni, that might have helped. Because, for example, like you're a fan of the shoulder, right? There are all these different tests you can do, and if you're doing every single test and you're trying to put the puzzle pieces together, you can be kind of confused at the end. Whereas I don't know if we maybe had this simulation practices where they're like, you have 30 minutes, do these tests, these treatments, and you sort of keep practicing and you find out what is more relevant and so on.
Do you do much like role playing? Like I know we did a lot when we started in terms of like pretending you got a condition and just do like 20 assessments over and over and over and kind of like practice. Is that something you do at uni or not really?
No, we definitely do it. Maybe we could do a bit more, but we definitely did it for every course. So they would go through the whole course, and then at the end we would have about a week or 2 weeks where they would either bring in actors or we would role play on each other. But yeah, I would just add a bit more of those role play type assessments and treatments, and maybe complicate it more.
It's probably quite heavy on the book, like the academic side of it and the theory. Whereas, which is great. You obviously need to know your anatomy and things, but like the role playing and the simulation type stuff's probably a little bit more real life. But I guess that's for the people that want to go into MSK as well. And that's where, you develop all these skills and knowledge from uni, but probably 25% of it, 20% of it is MSK. And then that's if you go down the MSK route, that's all you use. And the other 80%, you probably don't use very much. But it's interesting, isn't it? So, cool. So you've been a new grad now for 8 months.
8 months,
and you've survived, which is good.
It's going well,
Good. So what would you tell new grads coming through now? So like the new crop, they're about to graduate. What's your like top bits of advice for new grads coming through?
Yeah, cool. I would say first one would be to focus on communication. Even when you might be confused or you might have a complex case or whatever might be going on, if you're able to just really listen to your clients and understand what they want or what they need, what their goals are, and that will help you understand them better, and it will help you communicate with them better when it comes to educating them on how they can self-manage and teaching them how, like different exercises and so on. So I would say be empathetic and listen and work on the communication skills. Number 2, I would say be willing to keep learning. There's so many resources. I mean, Health First Group has a lot of resources. There are PD videos and mentors and different people you can talk to, but there's also resources outside that you can like learn from courses, or even like you can reach out to your professor. So for me, every time I would come across anything that really made me feel stuck, I would have someone either in clinic to talk to or one of the mentors that we have in Health First Group. Shout out to Jared, helped us a lot. Or yeah, just look online, do some research, and keep learning. And I found that the most fun. Whenever I would see something, I would get stuck. They come back for a second session, and I'm able to help them out, and it would feel really rewarding. So those would be sort of my top two. Yeah.
I used to love that. I used to get like a buzz when somebody come back and you kind of you learn about it, and then you'd implemented a treatment strategy, and then they sort of come back and they're like, wow, I'm loads better, and that's kind of what it's all about. And you kind of never get old of that, like that feeling of like the patient actually getting better and them actually being really grateful. Yeah. That was one of the things that I disliked about working back at home in England, unfortunately, was that working in the National Health Service with kind of busy caseloads, lack of being able to see clients regularly, you kind of see them once a month. I started to dislike a bit. And then when I came over here, you can see people twice in a week if you want, or, once a week, or, you can see them a bit more intensely, and then they actually get better. And you kind of think, this is kind of what you do it for, you know what I mean? And that never gets old.
Yeah, so in the UK, there is the NHS, right? And that's a public system. Yep. And most clinics work through that system.
Yeah, it's interesting. So I haven't been, I moved from the UK 9 or 10 years ago now, but when I was there was a National Health Service. Most physios would sort of go into the National Health Service first. Yeah. And then they might go into private practice afterwards. I was in the NHS for 5 years. I did a bit of private work on the side as well. Now it seems that a lot of private companies seem to be sort of, this is, I might get corrected here when this goes live, but this is my outsider's take on it. A lot of sort of private companies seem to be buying NHS sort of contracts and winning NHS contracts to provide NHS services. But there does seem to be it is different to the sort of private world over here with private health funds. Regular treatment, hands-on manual therapy, getting to see your clients a little bit more regular. There does seem to be a slightly more sort of hands-off sort of exercise-based approach. Yeah. But I'm sure there's hundreds of fantastic private practices over there as well. But there is a big sort of public setup over there. Whereas in Australia, if you twist your ankle or hurt your back, you're probably not going to go to your GP. You're going to go straight to the physio. And you'll see that sort of 1 day old ankle sprain, whereas there's a bit of a sort of mentality back at home that people go to their GP, then they might go back to a GP 4 weeks time, and then they'll go to physio. And by the time they get in front of the physio, this was back there, they're kind of chronic. They're like 3 months on, and then it's just a lot harder to get a result with them, unfortunately.
Gotcha. Okay.
But yeah, I mean, I love the NHS. I think it's the best thing ever. But like I say, I haven't worked in it for a long time. And I certainly, from a treatment perspective, I prefer the sort of system over here.
Yeah, and it's kind of a mix here. Like people can still go to the GP and come see us, or they can just come see us. So
yeah, I think accessibility is better, which is what I quite like. Here. Yeah. So that was 2 points. Have you got another one for the new grads?
If I chose another one, I would go back to keeping it really simple. Yep. It might just be me, but you tend to overthink and overcomplicate a lot of the assessments and treatments, or even the subjective. I would ask way too many questions about things that later I would think about, and I'll be like, this probably didn't matter as much, and then I didn't have enough time to do all the other things that maybe mattered later on. So maybe clear the red flags. Choose the most important assessments, maybe the active range, for example, and something manual, checking the neuro tests, and then choose your top 2 exercises. Just keeping it really simple reduces your own stress, helps you have more time with the client and explain everything. So that would be my third one. Yeah.
Good. And quite early on in your sort of career, obviously, but are you starting to form a bit of an idea as to where you want to go from a clinical perspective? Like you're probably just a bit of a sponge at the moment, soaking up everything you can. Yeah. But do you know, like, longer term, whether you want to specialise in one area of physio, or do the titling process, for example, here in Australia, or?
Yeah, so it's still too early. I'm still exploring a lot, but if I had to choose one right now, I would choose the most difficult one. And for me, it would be either the complex chronic pain clients, let's say chronic low back pain, or radiculopathies. Those were the two that I had the most difficulty with during my new grad process, but I did take a couple courses and I started learning more about them. So I would probably choose those ones if I had to focus and learn more, because I think a lot of people suffer from those things, and if you can help them out.
I'll have to ask you again in another 12 months and see whether you've changed your mind, but it'll be interesting to see whether you're on the same pathway.
Yeah,
it's funny what you said about the course in terms of, and you mentioned about shoulders. So I mean, I love shoulders. Shoulders is kind of my thing. If I could see just shoulder patients, I would, but I hated shoulders for probably 18 months to 2 years at the beginning when I graduated, and really because I didn't have the knowledge to really understand it that well. And then I did some courses. I think I mentioned to you, I did the Jeremy Lewis courses, the first and second course back in the UK. Did a few other sort of online sort of shoulder courses things. And then like I kind of just realized like I loved it, and it was purely the lack of knowledge originally, I guess, that put me off. So that's my advice to new grads as well, is that soak up as much as possible, but then, you know, the things that you don't like tackle them head on, because you probably will find that you actually maybe quite like them. You just don't have the knowledge at the beginning to understand it enough. And especially, I mean, lumbar and those sorts of areas, and hip and pelvis and SIJ, like, you know, there's a lot of crossover there, and the more knowledge you get, the better equipped you are to deal with those conditions. And you never know, you might sort of go down that sort of path that originally you wouldn't have even considered.
And as a new grad, you have so many people around you that have all the, like, not all the answers, but a lot of good answers. So, just ask people.
Yeah.
Or you've seen your physio, or ask Phil, email Phil.
Just don't ask me about back so much to that. The other thing as well is like taking a little bit, I think, from different people. You'll probably, like, I don't know about at uni, but like as a new grad, you'd probably feel that like you learn something and like that's the answer. But then like as you go through your career, as you get a bit more experience, you kind of think, well, that's their answer. And then someone else has got a totally different opinion. And someone else has got a totally different opinion. And I guess you kind of, you know, then merge your own opinion onto it, with all the different sort of bits of knowledge. So, it's sort of, that's a good thing, that no one's really right. Everyone's right. If they can back it up with a research paper, then they're correct. It's just about sort of, you know, clinically justifying it yourself and making your own decision.
Yeah, that's the beauty of physio. There's definitely a lot of things that do help, and there's probably a lot of good research on different types of treatments, right? So two physios might be kind of different in how they approach different conditions, but they can both help that person equally. So you're not sort of stuck to having only one type of treatment or one way. So you can keep learning from different people and create your own, I guess, way.
Perfect. Good. So one final question. You've gone through our sort of Health First Group new grad program. So how did you find it? Any advice to anyone that is looking currently? We will be recruiting for next year. How did you find the whole Health First Group new grad program?
It was really good. It was really smooth, because I found the video on Indeed, I believe, and I just applied, and I heard back from you guys right away, and we had an interview, and it was pretty casual. We had a chat like this, and I learned about the company, and then you guys learn about us, obviously. And then after you start going through the process, there's such a big team that you can reach out to. There's like the HR and different people that help you organize the paperwork, and then you start working, and then you have the PD videos, you have the mentorship sessions, which were weekly. Now they're fortnightly. So anything that you have questions about, you can sort of reach out to different people and learn. You guys are quite easy to reach to as well. So overall, it was Yeah, it was very smooth, and like the buildup of clients was pretty good.
Yeah, so how did you find the beginning? Because a lot of new grads kind of worry about that, because I think some people do get thrown in the deep end a little bit. So
Yeah.
how did you find it?
Yeah, so we started with 3 clients per day to start with.
Yep.
So very manageable. Like you do that in placement anyways. You're seeing probably in placement you're seeing maybe up to 5, 6, some depending on where you are, but 3 is quite manageable. And then as you feel more ready to see more people, then you can build up on that. Because obviously as a new grad, you're trying to prepare. You're trying to see the GP letter and plan what you're going to do and then go through it and then think about it, talk to your maybe advisor about it, so on and so forth. But you slowly progress until you have a pretty full schedule and you're just working full day.
Yeah.
Yeah.
Good. Yeah, it's sort of in its 4th year now, so we've sort of changed it, added things, moved things out of it, and changed as we've gone along. We've learned as the years have gone by what works and what doesn't work. And what I sort of say to people in their interviews is that it's not fair to you to throw you in the deep end, but it's also not fair to our clients either, because you're not going to get good results. You're not going to be happy. Everyone's going to be stressed out. It's just not going to work. So we just grade people up nice and slowly. And some people go really, really quite quickly and then adjust to it. And you were I remember you were pretty keen to be busier sooner, which was good. Some people take a little bit slower, but we just kind of slow that caseload up, and you're managing a pretty solid caseload now with no difficulties, which has been great.
Yeah, you just need a bit of time to think things through when you first start. So it's really nice to start off kind of mild and build up. But there's so many resources and so many people to talk to. It made it really easy and smooth. And by the time you get to a full caseload, you're managing it pretty well.
Good. Last question. So you've worked in 2 of our clinics. You've been in Goldie and you've also been in Mount Isa. So regional living in Mount Isa. How did you find it? I lived in Mount Isa for 18 months. You can Google Mount Isa and come to a sort of conclusion, or you can go live there, which is what you did. So how did you find it?
Man, it was such a good experience. I'm so happy I did it, and I'm doing it again. So, Gold Coast is probably the best place in Australia. So in terms of location, it's the best. But when it comes to work, I had so many cool experiences in Isa. I ended up working with 2 sport teams. One was AFL, one was rugby. So that was brand new. I ended up having a full caseload, seeing different things like NDIS clients. What else? I'm trying to think. Like Vistib clients, seeing some pediatric clients. So you just have like a lot more types of clients that you get to see and learn from.
I have a lot more opportunity to learn up there, isn't there? Because there's such a need and demand for the service.
Yeah. And
you can really see a lot of different things.
Yeah, and it's a small town, so there are a lot of young people like myself that go up and work in different fields, whether it's the mines or I don't know, nursing or different things. So you end up building a friendship group, and you can have a lot of fun. You can play sports. You get to know everyone at the gym. It's got that sort of
community vibe, isn't
vibe.
it?
Yeah.
I found that when I lived there. It's like one of the easiest places in Australia to make friends.
Yeah.
Because everyone's in the same boat. Everybody gets up on a Monday morning, they go to work, they work hard, they play hard at the weekend, and they get back to work. And it's a nice sort of cool environment. Like areas such as Goldie, beautiful places to live, but maybe a bit harder to settle into sometimes. Whereas everyone's in the same boat in those sort of regional communities, which is why it works quite well.
And also a big positive to go to Isa is that the money's quite a bit better too. So
there you go. Good plug.
That's another bonus.
Good plug for going regionally.
Yes. All right. Can I ask one last question to finish?
Yeah, mate. Go ahead. Go ahead.
Right. So, how did you end up meeting Shane and building this empire? It's a big question. You don't have to go
empire is a big word. Yeah, good question. So, me and my other half left England to go travelling. Traveled around Asia. We landed in Australia. I had every plan to work in Australia for 6 months, and then keep travelling again. So I signed a contract to work for Shane in his previous company, and I worked there, and my plan was to work for 6 months, pick up a check, keep traveling. Going to go out through China, back through Russia, Trans-Siberian Railway, and back to England. But me and my other half just fell in love with Australia, and decided to stay. So I ended up working at that company with Shane for 4 or 5 years. And then we decided to sort of go into business together and start our own clinic. So that was the Gold Coast clinic, which we purchased, plus we started a clinic in Mount Isa.
Yeah.
And things have snowballed from there. So, no signs of slowing down. We love it. We enjoy what we do. Nice. I don't treat anymore, but I kind of like doing the mentoring side of things, so that I can kind of keep my eye in from a physio perspective. I really enjoy doing those new grad orientation days, and the brainstorming, the clinical reasoning stuff. Seeing clients on a day-to-day basis now, probably not for me. But I did that for a good 10, 12 years, I guess. So I sort of enjoy being on the other side, doing a bit of the mentoring stuff now. So that's where we are. Health First, we're doing really well. We've got another couple of clinics we want to open up next year.
Nice.
And keep progressing on.
Amazing. That's awesome. Good to hear.
Cool. All right. Well, thank you for catching up with us. Really appreciate all of your insight. Hopefully it's useful. I know there's plenty of new grads out there that would be interested in what it's like to work in private practice. Thanks for coming on, and we will speak to you again soon.
Thanks, Phil. Have a good day.
No worries, mate. Thank you. Take care.
Cheers.